Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the Functional Code.
Welcome back, everyone, to the Functional Code. We are excited to bring you guys today a new episode. So this I believe is episode 2 in our series. And so we're doing a series right now on how to utilize AI in your life regarding obviously health, fitness, wellness. And today we are going to be talking about how to use AI to find a better doctor. As always, I am Dr. Addy.
And I am Dr. Jace. This question I know we've gotten asked numerous times. It's a lot of the times in the past it's been searching Google, what services do they have?
Yes.
This is where AI can come into play quite well and
Yes.
take into so many other things into consideration.
Yep.
So there's a stat that I thought was interesting. Diagnostic errors affect roughly 10 to 15% of medical cases. Now, what that necessarily means is the diagnostics are how a physician diagnoses what you have definitely can affect the outcome, treatment measures, and everything else involved. So necessarily, even on that standpoint, is finding the correct person, provider for you in your situation, and that's what we're going to get into today. Doc,
Yes.
What is your thoughts on that?
And just making sure that you get the correct diagnosis to move forward, because a lot of the times, if you show up at a place and you started treatment and you're not seeing the change that you've been looking for, especially after a certain amount of time, you need to start sticking up for yourself and questioning that this may be not the right place for you, the right provider for you, or you need to start asking some hard questions on what the expectations are of the doctor.
Yes.
And Dr. Jace and I are definitely going to be talking from more of a main frame of musculoskeletal, but there are still some other things that we've picked up on as far as certifications and trainings and expertise. So there might be some other things that we sprinkle in on top of that, but for the most part, we really want to make sure that you handle your pain appropriately. That's going to be probably the big basis of what we're coming from today, but you'd be surprised at the cycles that patients get in with providers, referral networks. They are just getting sent to all of these other medical providers, and they end up wasting 2 months just to get these appointments settled in, and their pain hasn't improved in that time, and they're miserable. What we are right now, we're going to be communicating is, how do we get you to that one person who's going to then make a difference? Because we want to make sure that we get after this as soon as possible. You don't stay in misery for months on end and not see any change or results.
Yes.
Yeah.
In addition to everything Dr. Addy said, big thing I look through is what can you control? Control the controllables. And with us bringing more information to you, and whoever listens to this cannot use that excuse of, I'm blaming it on the medical system, which yes, it still might have a part to play, but for you actually knowing where to start or where to look, that takes a huge cascade of run around the mill kind of deal out of it. So let's dive into some of what is a better doctor. Now, this will be specific for you, your symptoms, your presentation, acute injuries, like traumatic injuries that may have just happened, or something that's been lingering on.
Yeah, so I think one of the biggest misconceptions is people tend to overthink or overshoot the severity of their problem and choose an overkill solution for a solution or for a problem that's not as severe as what they think. What I mean by that is, obviously, if you get a scrape on your arm, let's say you bumped against something, we're not going to put you in for life-saving surgery at that point, right? However, there are times where we tend to, because of the issues and severity of certain things that can happen in someone's life, we tend to gravitate towards the big items, the biggest things that we can think of: surgery, harsh medication, a lot of paying something, thousands of dollars worth of something, when in just taking a bigger look at what's going on from a good doctor who can actually understand how to make those differences. Just a few lifestyle modifications may make a huge difference before we jump into the end there. And so the high impact line that I want people to understand is, a great surgeon might be the wrong doctor for chronic pain, because what we've found is surgery is in the short term sometimes successful, but in the long term, comparative to physical therapy, other exercise, in terms of chronic pain, musculoskeletal pain is what I'm talking about, most of the time at 2 years it meets equal for outcomes. So you got to understand that, yes, at the time you're in dire need of intervention, and yes, we understand there are times where you are needing help. But what we really want you to know is, please don't go and choose something that's overkill for your solution. Get in front of a provider who understands pain. Get in front of someone who understands how to help you, and make sure that you don't choose something that you're going to regret later on. So this is how we want you to reframe looking for the said doctor. Things Dr. Jace and I would probably use verbiage-wise to look for these doctors. And then obviously how to sort through this on AI so you guys find the right person. So
love this.
Yeah.
So let's dive into, if people have no understanding of the medical terminology, that is okay. If they don't understand certain specialties or names of the specialties, describing the symptoms and being more specific with the context you put into the AI model when trying to find the correct doctor is going to be more important.
Yep.
But again, the more specific you can be, better long term.
Yep.
Well, I guess we can almost get into a couple things of how to either optimize the search, which goes back to, if you haven't seen our first video on R.C.O.P.E or R.C.O.P.E, where that goes into how to make the prompt. You can also ask AI, help me make a prompt, I'm trying to find a doctor, and it'll run you through a bunch of questions, but this will accelerate the process more. When you're looking at how can we build this thing up, a few things are what not to do.
Right.
And that's where some red flags can come into play.
And before we do that, I even like to talk about what AI can and cannot do.
Yes.
So that before we jump into how to do it,
thank you.
Let's do that. So
cool.
I would say we'll go 5 different things, what they can and cannot do when it comes to health. So for the first 5, it can absolutely translate medical jargon. So we can feed it information, let's say a report, and it can break it down maybe in easier terms for you to understand. So it can definitely do that. Explaining roles and credentials, it can explain what this doctor does versus this doctor, what that credential means, what it doesn't. Obviously, it can help you break down what that background of that person is. It can generate structured questions, maybe asking you questions about yourself, about the pain, about things like the problem in itself. And then it can even identify red flags. So if you presented let's say a bulk explanation of your symptoms, it would be able to say, hey, just so you know, what you just told me, there is one part in there that's concerning. There's something you should be thinking about, which is helpful. But what it cannot do and it will not do, it will not diagnose. Okay, it is not a doctor. It obviously is not going to prescribe any medications, any treatments or therapies for you. It won't replace a great exam, physical exam. It won't replace labs, imaging, and it will not override clinical judgment. Again, it's just a tool both providers and patients should be using, but just making sure that it is there just as a tool, not as the final say.
Love that.
Yep.
Yeah, it's connecting the loop between all this other information that you may not know to help better communicate to the physician to work alongside them in the grand scheme of things as we're moving forward. Now,
so Doc, what are some things to pay attention for when you look for a provider?
Yes, that's a great question. It depends on what is going on with you and your system, but let's take...
Should we go low back pain?
No, let's go
low back pain. Okay.
Cool. So for lower back pain, there's a few things that you would want to look at. Most commonly, medical care provider or MD. You have to take into consideration what tools do they have at their disposal. So if you have lower back pain, the most advantageous way to go about this would be either going to a physical therapist, chiropractor, starting there. But if you want to dial in that even more, you could see what certifications do they have. Are they licensed in your state? You'd be surprised. If it's out of the country, what license do they have in it or certifications? And then it's going into what cases have they worked on in the past. And this may come back to AI might search, just thinking about the database, on what are some of the Google reviews or reviews they've had online, and then it can pull it up that way, which that's also a reason why that reviews are important. So when you're getting good feedback, when you're getting good quality care, to help relate that to others or other databases is important. Then how is one able to communicate with the physician? Are they more open? Do they speak even your right language? I know in Arizona, for certain individuals, they need a Spanish-speaking provider or translator, which even with some of the AI stuff, it's breaking down those walls as well. You can get into, are you referred by someone else, and is it based on who they know? Are you stuck in this referral cycle loop that the provider or group of providers are within? If that is the case, that can narrow in potentially the results that you may get based on what tools they have at their disposal. And then the other aspect is guarantees and results. Because at the end of the day, you want to get this lower back pain under control. What results have that provider or those people that you're seeking, what have they gone or what have they gotten before? And the compliance aspect as well is a whole nother thing. Doc, would you add anything?
I would say those were all incredibly important. The only other thing I would say is you also want to just act for yourself as far as the outcome portion of this. And we're going to show you how to build a good prompt, again, using the R.C.O.P.E system. But just as general, you got to realize that a lot of the information that AI was built upon is research that was built by mostly the pharmaceutical companies. There's a lot of medication studies, other types of things like that. And you also have to look at what other things it was taught by, which is more Western society. There might be differences in censorship, what is shown, what is not shown. So you have to understand who built it, who built AI. AI is not its own entity. It is a created tool by some company, and it was fed information, and I can assure you it's monitored and limited in fashions. If there are some questions it will not answer for you. And so there is a limitation to it, and it does choose to give you certain things based off of certain limitations. So one thing that I think is important to understand is if you have already a person you're looking for, tell it that, because otherwise it's going to feed you maybe someone that you weren't looking for, and that might also alter what you're going to choose in the end. You can say, I want a non-invasive, conservative doctor option first. I don't want surgery. I don't want medication. I don't want injections. That is something you can tell it right away. And of course, we're going to show you here with the prompt engineering, the actual way to do it. But these are things that you just don't be afraid to communicate that to the AI agent. Otherwise, it is just going to shoot out what it has in its body of research.
That's beautiful. Yeah, really well stated. So I guess what is a bad prompt?
Yeah.
We can start there, and then let's dive into like all the specifics as we move forward.
So if someone has back pain, and I'm sure you guys are already predicting this if you've been watching us, but a bad prompt would be, find me a doctor for back pain. That's going to be already not a lot of information. It'll give you an option. It absolutely will give you an option, but we're trying to get you the right doctor. We're trying to save you time. We're trying to actually give you good outcomes of what you want. Should we do the bad prompt first, then the good prompt, and see what we do? See what we get at the end?
I'm actually really curious. Interesting. All right, so it goes into your primary care physician, first point of contact, which
we'll get there.
We'll parse through
We'll
this.
get there. What does that say? Oh, physiatrist.
Yeah, you're right, physiatrist.
Physical med, rehab, obviously
so
what
they're
we
just
do.
grouping it all together. Pain management specialist.
Okay.
Orthopedic spine
And
surgeon.
so they're already jumping into surgery. Neurosurgery. Oh, wow.
Wow. Other specialties, neurologist, rheumatologist, chiropractor,
Hey, we made the
therapist. So it's down there. Summary gives us some notable specialists. Lord
Surgeon, pain management, and
MD, PhD.
Okay.
And Lord knows where this person's even at.
Yeah,
this
curious.
is in Virginia.
Okay, so yeah, not very specific. Grading that as far as an outcome of what you should have got. I would grade that as a D.
So.
Maybe even, maybe give it a C minus, but that's about a D.
But even on the back end, it says, if you want, I can provide specialists near you in X region, for us, Phoenix. But that's the only follow-up it has. It also has, do you have any other cause of pain, severity, symptoms? So it's already asking you to go more in depth, but now let's take the other approach.
All right, so now we're going to build a better prompt. So
Beautiful.
As we've talked about now, the R.C.O.P.E system, we're going to talk about roles. So now this isn't role as a provider. This is you needing the AI system to be something for you. What we would mention is act as a conservative, evidence-based healthcare system navigator. I think evidence-based is always appropriate.
Yes.
But telling it's helping you navigate versus telling you what to do was a crucial word. I liked that you put navigate in there. I really like that word.
Yep.
And then, of course, conservative, because we should always want that as an option first in regards to musculoskeletal pain. That's what I'm saying. You want to argue with me on other parts of the systems, whatever. But for musculoskeletal pain, I can assure you conservative is always going to be the first route.
Yes.
And that's where we want to make sure that we get there first. Next, Doc, what was for context?
So context, I am, for example, 45-year-old male with chronic intermediate lower back pain.
Yep.
Symptoms fluctuate with stress and activity. No red flags like bowel or bladder issues or progressive weakness. Now,
that might be a tough one for them, but maybe what we could also say is if you have any symptoms that you feel are scary to you, that could be something you add in at the end. Would you agree?
Or that you feel that might be related.
Sure.
Which for anyone with lower back pain, if you have symptoms related to gut, bladder, weird pain going down the leg, sciatica, all this kind of adds into it. So as we go through, you can add in your specifics and not just the example, and they'll start you through the process as well.
Okay.
So even like going back to symptoms fluctuate with stress and activity, what specific activity? Is it bending? Do you notice it? Is it worse laying in a certain position? Is it worse with X exercise? Again, specificity.
Love it. Love it.
Objective. Doc, what do you think for that one?
So now we are trying to basically put ourselves in this scenario now. So we want to identify the most appropriate type of medical professional for further evaluation, not a diagnosis. So you could absolutely put that in. I would even also include find me a provider within 20 miles is maybe where I would start. And that kind of gets into parameters too, but I'll just include that now. You can even then include plus if they take insurance. Because if you do want someone who does take insurance, that can be something that can help you set the objective. And then I would maybe end with this provider has a gym setting on the side, or they definitely prioritize rehabilitation. Maybe something like that. Because I don't know how else you could communicate that. Has rehabilitation with the services they offer, or maybe something like that.
Beautiful.
Yep. So now, Doc, as we get into the P parameters, what would be some things you wouldn't want it to do or give it some ability to not do?
So this is going back to guardrails, where, exactly what things should or should not do. And this is where AI, again, doesn't diagnose. So I would say parameters do not diagnose or recommend treatments. Again, we're trying to find the provider. The provider will help for the treatments, help for the diagnosis. It's pointing us in the right direction. Like, again, where's our thing we're trying to do? Again, also prioritizing safety, evidence-based care. I know we brought that up previously. And also appropriate escalation. So what that means is, and I like that they put that in there, because if they go 0 to 100, or if some of you have been to providers that say, oh, you may need surgery down the line, but for right now, or let me know when you're getting to that point. And it goes 0 to 100. It doesn't allow proper management, maybe physical therapy, chiropractic, physical trainer. And if that doesn't work, okay, maybe a pain specialist, maybe a consult with an orthopedic doctor. Then it's the progression to potentially surgery, other hard drugs. So you can see how it can move along, but you want that appropriate referral base.
There is a step in there that even a lot of other people don't understand, which is the mental health provider.
Oh, yes, sorry. Thank you.
No, I just wanted to make sure that's probably something that is missed even most lately.
Yes.
Some are getting there as far as management. Some will do the PT route right away from a surgical referral or a pain management referral. Some will do that. But I don't find a lot ever look for yellow flags, mental health issues, because chronic low back pain is heavily tied to psychosocial issues. So also in this route, I'm curious if they'll, using the evidence-based system, even recommend that.
And then the last thing was red flags that won't require urgent care. Can you explain the red flag, yellow flag, green flag? I know we brought that previously,
so
but I love that.
Red flags in medicine are anything that require urgent, we'll call it urgent intervention, right? Yep. For this setting, low back pain, if someone has what's called sciatal anesthesia, which is, it feels like they're numb around their groin and privates, almost as if they're sitting on a saddle for too long, if you're familiar with a horse saddle. That's where it got the name. Or they're having changes in bowel or bladder, inability to go or can't actually stop it from going. These are changes that are concerning and severe. And so that's actually something that we would try to get you to go urgently meet with a surgeon right away, or even talk about very quick urgent intervention.
Yes.
Now, yellow flags, that's a term that was, I can't remember who coined it, but it's a yellow flag questionnaire is what we have patients fill out that really helps to tie psychological or social, we'll call it problems, to the pain itself. And so the questions that they ask help to pick out if you have rumination habits where you're constantly thinking about the problem, which is making your problem worse. You have fear avoidance tactics where you are afraid of doing any movement because you think it's going to make it worse. So you actually are limiting yourself from training, moving, being better, and that's going to obviously make a difference in the impact of your care. And among other things, there are other habits that you can pick up if there are psychosocial things going on. So depression, anxiety, all the other things definitely have shown ties to chronic low back pain. These are the things that it would then, it's not necessarily urgent, need to go to the ER, but it's something that we would then have to change course of treatment, because these are things that should be also addressed while going through care. Yes. And that's important too, to pick those out.
And that's so important, really well put and stated. And if you feel like some of that information is more pertinent to you, but you're more focused on lower back pain, they might be interconnected, and that's where you can put into the context portion within the prompt if you liked as well too. But
even if you want it as a parameter, as we get into parameters, you can use this as a statement. I'm interested in using the biopsychosocial method as a way to manage my issue. That could be a parameter. So
love that.
Now the AI agent might start to think of the mental health component of it too. Maybe they'll have something pop up.
I'm curious to see if it pulls it up without even putting it on there.
Without even, okay, perfect. Actually, I like that too. I do like that. I don't want to sway it too much.
Yes.
In the future, obviously, if you guys have that, please sway it for you. But we want to see just by itself as the evidence-based as a parameter, will it actually pull it up?
Yes.
So parameters: do not diagnose, recommend treatment, prioritize safety, evidence-based care, appropriate escalation. So Doc, great job there.
Beautiful.
Lastly,
expected
outcome. So now this is what you're looking for. And this is, I like how you put this because this is important. You definitely want relevant specialist types.
Yes.
Next, training credentials to look for, red flags if you have them, 5 high-quality questions for an initial visit. That's my favorite by far.
Yeah, you
I
can
love
add more than
that it, for sure. Yeah. I love that it hopefully will create good questions for you to ask, helps you be empowered, helps you take control of the visit, because you should be.
Yep.
You absolutely should be leading that.
And the physician should, so let's have this kind of start thinking. The physician should be able to answer almost every single question, or at least hear from their answers, whether they, even if they say, I don't know this, that's also a really good standpoint, instead of them kind of BSing their way through.
Good
or
point.
Trying to filter the patient into a box of symptoms.
If you feel like they dismissed any questions, if you felt dismissed, if they didn't listen to you, if they didn't even want to answer the questions, that's going to be a tough one for me, red flag for me.
Yeah, very true.
All right, Doc.
All right, so it popped up, it went back through everything else. It says the number one appropriate specialist for further evaluation
keep getting beat.
is still primary care physicians, which it's, again, not a attack on them. I know they're overwhelmed with other pain, and the only options they have, it's quite frankly medicine or referral to physical therapy.
And I get it,
But
there's definitely already, we'll call it mainstream understanding of what happens when you have an issue. It's you go to the doctor if you have any issues. But what we're trying to improve and help is based off of all the education that we've received, all the research that we've now spoken about, especially including the back series in the Lancet, which really spoke about how Medicare professionals are really burdened with musculoskeletal pain.
Yes.
They don't feel as comfortable treating it. They don't want to treat
Key
it.
point.
And all they can do is give you medication. So they're going to refer you most likely anyway.
Yes.
And if you want to save yourself some time, go to B.C. Moving forward, those were probably the places that we should be going first. And it was stated in the Lancet, that's where you should go. First line of intervention is your chiropractor, your PT, acupuncture at sometimes. That's going to be who I would run moving forward.
Beautiful.
Yeah.
So that's where physical medicine and rehabilitation, same offices we run. Physical therapist is up there, and then pain management, orthopedic spine specialist, and chiropractor.
So they did add chiropractic in, which is
I'm
interesting.
still really surprised based on the research. That's not further up.
Do you think
therapy, but
that this is in chronological order of who they rank, or do you think this is just a list, non-randomized?
Well, let's ask.
Yeah, let's do that.
Okay, so we're asking, is this list in order of recommendation or is it just random? Which kind of gives us it's not random.
It is not strictly ranked though. Okay.
From best to worst. Okay. It is also we should probably put that in the parameters, but again, we wanted to see.
Okay, so they didn't include it. They didn't include us in the first list then. Okay.
So first conservative, physical therapist, primary care. Yeah.
My guess would be
And chiropractic, adjunctive, but
going to your PCP is still helpful if you have one established because they can rule out the red flags, helpful,
yes.
and then obviously get you to where you need to go. Again, we're just trying to save you some time, but I could see that still being helpful.
Let's go back up. So we went through the order of specialists, and then it goes into what training/credentials to look for physicians, whether they're board certified, experience with musculoskeletal medicine,
So Doc and I are both board certified to do physical medicine. So that would be what they're talking about there.
Yeah, physical degrees.
Okay, so
and
DPT,
then, yeah. And then it goes into red flags for the practitioner, and this can be cautious of practitioners who guarantee cures of 100% of pain elimination.
I like that.
That's really smart. Focus on passive modalities like long-term traction. God, there's just so much others here. Depolarized exercise, strength, or functional
That's a big
assessments.
one. If you find that you don't have any type of an exercise or strength plan, especially with musculoskeletal issues. Yeah. Obviously, you and I understand that, but that's a big one.
And then, also with these red flags, if you encounter any of the following medical red flags at the evaluation, seek urgent care. That's like loss of bladder, bowel control, exactly some of the stuff Doc said, weakness, severe fevers, or night pain, stuff like that. That could be some underlying stuff. Now, the 5 questions to ask your first evaluation. Number 1 is, what is your approach to evaluating chronic lower back pain?
Love that.
And then in quotes, it says, look for emphasis on functional exam and movement assessment. I think that's so important.
And Doc, it sounds silly, right, that they would even state that. But how many times have you had a patient come to you and say, the doc didn't even touch me?
Yeah.
Didn't even look at it. Didn't even look at my back.
Medicine is, you can find a lot with movement screens, and that's where telehealth for musculoskeletal pain can come into the parameters. But if you're going somewhere and if they're not doing actual exam with you or
put their hand on you, even just touch the back, just to see for firsthand.
Yeah.
I had a patient, and I try not to be too off topic, but I had a patient come to me who had immense back pain, okay? And she had gone to this provider for a month, and week over week, no change, okay? I said, what did they do for an exam? They're like, they didn't do an exam. Just started treating me. And I'm like, okay, there's our first problem. Oh, I said, where's the pain? And she showed me where the pain was. I said, do you mind if I look just to see, make sure there's no swelling, whatnot? There was a ginormous skin boil lesion that was oozing that she didn't know was there.
Oh, my Lord.
And it was infected, very infected. And it wasn't from a musculoskeletal. It was no back issue, anything like that. Maybe the provider took an X-ray. I don't know, but didn't even have the gall to just look at the skin. And so when they say emphasis on these kinds of things, it seems like it should be logical. You'd be surprised at what providers skip in certain things.
Lord. Yeah, that's a really good point on that side of things. Now, second question, do you prioritize or provide individualized rehabilitative plans, exercise, mobility, posture,
love that.
specific to what's going on with you? And that's, cookie cutter approach doesn't fit for everyone. Results get limited. Better you ask that question sooner than later. Yep. Question 3, will you coordinate care with other professionals?
Ooh.
Example, physical therapists, phys med specialists, if needed,
I like that.
So if certain providers don't have the resources in office, instead of just going through their scope, their lens, are they able to provide other sources to help along with the treatment to get the care that you need? So love that question. Question 4, what diagnostic criteria or imaging guidelines do you use before ordering studies? Now, this is different.
You mind if I answer this one?
Please do.
I like this. So here's how I would answer that if a patient asked me that. I would say for someone with chronic low back pain, a lot of the research shows you don't have to do imaging right away. It says that it even can be disadvantageous in the beginning. However, I would like to just start with if the patient had been having a lot of issues, hasn't been seen in a while, and for some reason they haven't been worked up in a while, then I would start with the least invasive imaging possible. So for here, X-ray is very non-invasive. It's very safe. And
MRI
we can see a lot. We can see a lot. Now, there are times where, and most of the time I'll do this, I'll say, because you don't have a lot of red flags, it's just the chronic low back pain, let's see what treatment looks like for the first 4 weeks. If no change, then maybe we'll do an MRI. Versus, nope, and this is what happens in the ER, and this is why we're talking about this, because a lot of the times you go into the ER, they throw a CT at you right away. They go MRI, they go this, and they don't even talk to you. They just, and again,
the bill wraps up.
You're
like, what the heck?
And you were just, so again, that's what I think it's asking, and that's how I would answer it. Would you answer this anything differently?
No, I think you hit the nail on the head quite well. Again, it depends on certain people. If it's like an acute accident, like a motor vehicle accident, there's a time and place for certain things, but that still comes back with the evaluation. That still comes back with the assessment, back to the first question, or second question, excuse me. So that's, again, you need to ask these questions. It's one of those things. Yeah, anything else you have on that one, Doc?
No. Cool. I liked the last one, though.
Perfect. Question 5.
I always got a plan, so that's great.
How do you determine when to escalate care, like interventional procedures or specialist referral? That's a really good question. How would you answer that?
So what comes to mind right away is someone with a herniated disc. Yeah. So that's pretty much it. Yeah. I have my plan already ready in my head to explain to them, because I want their expectations to be met. There are times where the treatment goes extremely well. Pain is very well managed, and we don't even need to escalate care. There are other times where we're not as lucky. It's a really severe herniation, and maybe they just don't respond well to care. Maybe they're not as healthy, whatever. There's a lot of variables that you have to understand, but basically I'll say, okay, I either choose to get the MRI right away, or maybe I wait a little bit to see how they respond to care, but eventually we would just need to make sure we rule in the herniation. So that's an important step. We do the MRI. Again, then I'll say, if for some reason we don't see change again after 2 or 4 weeks, then I think we need to ask for help, that's how I phrase it. Because I'm only having this conversation if their pain isn't being managed to their expectations.
Yes.
If they're like, no, doc, it's getting me, it's killing me, whatever, it's okay. While we stay on care, because it's still important to co-manage, we're not dropping you to the next step here. We're still staying on care. It's important to do PT, exercise, chiropractic during treating this. The research has shown that. But to help with the pain side of things, we can then escalate you to interventional pain management, maybe some advanced injections and what have you. Then very last case scenario would be the orthopedic surgeon, in which case I don't ever jump to. My referral next step is always usually interventional pain. Yeah, same. Very rarely I've jumped right ahead and done just a surgical consult. I did that with really severe spondylolisthesis, they were losing leg function quickly.
Ooh, yeah,
and I said,
yeah,
I think it's time So again, it's all about clinical judgment, but how do you have that conversation, Doc? What are some cases that you can remember you've laid the foundation for them?
I usually start prefacing, for most people, not everyone, is I'm going to assess and address and treat you if I'm in the same position you are itself. So it levels the playing field. And then in terms of saying, okay, let's paint the picture of you're not getting better in X amount of time, or you haven't gotten better in this long. How does conservative treatment look? If they still have done a trial of conservative care, then I go into what specifics, what does that look like of what you actually have done? Because if it's just getting a chiropractic adjustment a couple times like that, it's important, yes, but it also depends on what the injury symptoms present with to know what route is best to help treat that presentation. If they haven't gone down that rabbit hole, then I'd say, okay, let's start you on something. If this doesn't progress, then exactly what you said, pain specialists, surgeons. But for example, we had an individual come in, got hit from behind in a motor vehicle accident, fractured T1, and then that kind of bypasses a lot of stuff. You still, like for the case, we'd still want pain management involved, but then it's the consult with the surgeon on what steps to moving forward, and then I go, or the least invasive physician would take the step of the surgeon or neurosurgeon or whatnot from there, and then depending on what they say, then you can follow suit and kind of progress as we are going from there. But even from her, we're not even addressing or treating that area, we're treating other areas that are also affected. So there's still ways that you can keep getting results.
I love that. That was awesome.
Yeah, so it's interesting. So these are the questions, and again, you can also ask, give me more questions. Or if this answer comes up, how would I best ask another question that's like in my mind? So again, more specificity will give you a good understanding of what you're going into. And then the last thing it gave us was providers nearby, pain management.
Hey, we made the list.
Hey, let's go. Cool. So it has a little bit of everything. Yeah, it would make sense in Mesa office, but
they won. That's all right.
If I would put East Mesa,
for sure.
No worries. So it has, and it gives even locations, a map, even giving star ratings, which is good. So you can dive into what the referrals say, which I always suggest for most people. So that kind of gives us a good understanding. But again, this is finding the correct person for you and maybe having a couple in play. Let's say if it was life or death situation, if it was my significant other or family member, I would definitely probably utilize this search. But if it's urgent, then you just got to accelerate things. But if it's something that's been going for a long time, maybe having a couple providers in place and maybe going for initial exam, say I'm feeling out between maybe you and someone else, asking these questions for both individuals, both clinics, and then see what place, what staff, what physician resonates with you.
And it's not offensive to have a backup.
Yeah, 100%.
It really isn't. I have had plenty of second opinions. I've also had people tell me they want to get another opinion, and I welcome that.
Yes.
There are just times where people need more information, and we want you to get that because we want you to feel comfortable. We want you running that in your care.
Yes.
I don't want you feeling that you have to listen to every doctor you go and see right away because that's just what you've been shown and told to do over time. You definitely have more say in your care than maybe you understand, and we want you to have that. It's very important that you take care of yourself, stand up for yourself, communicate, ask questions. It's going to be better in the long run for your healthcare.
Yeah, love it.
Yeah.
So utilize this system, this prompt engineering, and get used to it. And this could be used with ChatGPT, Gronk, Gemini, like most any AI agents. Like some might be better than others, but again, it's starting to get used to some of this technology to help you leverage it.
I'm curious what that would have looked like on Gemini versus, you know what I mean? We might do that at the end, and we'll show you guys the results. But hopefully this was valuable. Guys, please continue to utilize AI. It's super helpful. It's, again, just a tool. It doesn't replace anyone or anything, but again, it can really help you make decisions and give you good information when you're making these kind of decisions. So we will see you guys on the next podcast. Thank you guys so much for continuing to watch, follow, share, and subscribe. Have a good day.
Woo!
Disclaimer, the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the functional code. Until next time, stay well, stay informed, and embrace the science of living well.